Hypnose bite is one of the most common venomous snake bites in Sri Lanka. Though often underestimated, it can cause serious local and systemic complications. So this video highlights the key clinical features and management. It is one of the commonest venomous snakes in Sri Lanka, and it is belong to Hypnale group. And these bites primarily cause local envenoming, and it is major contributor to this snake bites is major contributor to snakebite-related morbidity in Sri Lanka. We talk about the epidemiology. It is widely distributed in wet and intermediate zones, common in home gardens, plantations, and forest areas. And bites occur mostly during daytime and early evening. And the high-risk groups are farmers, plantation workers, housewife, and the persons who walks barefoot. When we talk about the identification of the snake, this is a very short snake, about 30 to 45 centimeters, and they have a hump, a distinct upturned snout, and they are usually brown to gray body color with dark triangular markings. It is very easy to identify. What are the characteristics of the venom? The venom contains coagulopathy, nephrostomies, and cytotoxins, and cause minimal neurotoxicity. And this venom causes local tissue injury and coagulopathy. When we talk about the clinical manifestations, we can divide them into local effects and systemic effects. The local effects are, they cause immediate pain at the bite site, and they can cause swelling and erythema, and the blistering and the local bleeding, and they can eventually lead to tissue necrosis, which is not a common complication, and they can cause regional lymphadenitis. The systemic effects are coagulopathy, spontaneous bleeding like in gum, wound, shear, gastrointestinal bleeding, acute kidney injury, and thrombotic microangiopathy. This complication is very rare, but it is very severe. When we talk about the coagulopathy, there is venom-induced consumptive coagulopathy. So the features are, there can be prolonged 20 DVCT and the prolonged PTINR or APTT. And this complication, the coagulopathy, usually develops within 24 hours. And when we talk about the renal complications, the acute kidney injury may occur even without severe coagulopathy. The mechanisms are, it can cause direct nephrotoxicity or hemoglobinuria or microglobinuria or microangiopathy. And the renal complications, the most severe one is it can progress to acute cortical necrosis. This is rare. If that happens, we have to go for urgent hemodialysis. The initial assessment. So we have to stabilize the ABC. It's the usual approach. Then we have to get a detailed history about the time of the bite and the site of the bite. We have to get the first aid measures, and we have to identify snake if possible. The preferred one is a photo. You don't have to bring the snake. And we have to mark the extent of the swelling. What are the do's in this snake bite? We have to immobilize the affected limb. We have to reassure the patient. And we have to transport the patient urgently to the hospital. What are the don'ts? We must not use tourniquet, and no incision or suctions. And we must not use herbal applications. The investigations are, we have to do whole blood clotting time, 20-minute whole blood clotting test, and full blood count, PTINR and APTT, serum creatinine, urea and electrolytes to identify whether there is going acute kidney injury, and the urine fluid report for hematuria and proteinuria. How do we monitor the patient? We have to monitor their vital signs and the progression of the local swelling, bleeding manifestations, urine output. And we have to repeat the whole blood clotting time 6 to 12 hourly. And there is no specific effective antivenom for Hump-Nosed in Sri Lanka. The supportive management are we have to give analgesia, paracetamol or opioids, and we must not give NSAI. And we have to hydrate the patient with IV fluid, and we can give tetanus prophylaxis, and we use antibiotics if there is a suspicion of secondary infection. When there is a coagulopathy, we can give fresh frozen plasma. Usually it is 10 ml per kg. It's the only solution because vitamin K is not proven beneficial in this type of coagulopathy. There is AK, acute kidney injury. It is very crucial to early identify. And we have to maintain evolemia. If the patient is on nephrotoxic drug, we have to omit them. And if we have to go for renal replacement therapy because there is acute tubular necrosis, so we have to go for hemodialysis if indicated. And we can go for early nephrology referral. And the prognosis wise, the majority recover with supportive care. And the mortality is very low in Hump-Nosed bites. And the morbidity, it is very related to renal failure and organ tissue damages. So the key take-home messages are Hump-Nosed bite is common and clinically very significant. And systemic complications can occur. We have to monitor for those. And in Hump-Nosed bite, antivenom has a very limited role. And early recognition and supportive care saves life in this bite. That's all.